The University of North Carolina at Chapel Hill Division of Physical Therapy teamed up with the National MS Society Eastern North Carolina chapter to create a groundbreaking new scholarship for 4 physical therapy students at the university. With its emphasis on training and hands-on experience, it will help to provide vital outreach to the MS community and help improve access to healthcare for more than 4,700 individuals living with multiple sclerosis in Eastern North Carolina. Erica Byrne is one of the first UNC Chapel Hill physical therapy students to receive this prestigious scholarship. Through her experiences, we will explore the impact of her clinical education along with her mentor, Diane Meyer, and a client, Barbara Guffrey, who lives with MS. Through the opportunities provided by the scholarship, Erica has gained the knowledge, experience, and sensitivity needed to deal with the unpredictable nature of this progressive disease and has been empowered to keep people with MS moving. MS is a disease of the central nervous system. It is chronic and unpredictable.
As part of this program, I did a 8-week full-time clinical rotation here at UNC where I worked with Diane, a physical therapist in the outpatient neuro clinic, and I was able to work with several MS patients as well as many other diagnoses. And I had the opportunity to get to know Barbara very well. We worked for several weeks together and really helped her try to gain functional abilities and to just in general improve her quality of life.
I've had very positive experience here at UNC Physical Therapy. I work well with Erica and Diane, and one of the things that I like is that I consider all my healthcare professionals as a team. And here at the University of North Carolina, I feel comforted by the fact that my team, if you will, is under the same roof.
While MS can result in considerable disability, it does not significantly reduce life expectancy.
I've really enjoyed working with Barbara in physical therapy because she is very motivated to work with us. She takes the advice that we provide with each visit and attempts to utilize that at home. So it gives us good feedback that what we are teaching her is making a difference in her life.
People living with MS are often required to manage some level of MS-related disability for many years, which makes rehabilitation through physical therapy a vital part of their health care.
I think the stretching has really helped the most. It's taken care of chronic back pain that I've had. My second thing that I think has helped the most is my ability to now at least be able to manage stairs. That was always a chore for me, and I always groaned when I saw them. But now I take them a little bit easier, and that was a very big help.
Stretching is something that is extremely commonly used with patients with MS because they do tend to have a lot of spasticity, and especially stretching the lower extremity muscles such as the hamstrings and the quadriceps can help people with their walking.
After a typical physical therapy session, I must say I feel very hopeful. I feel that I've made some progress, that I'm better than where I was when I walked into the gym, and it's just it's just a sense of hopefulness that maybe, just maybe, I can stay where I am or even improve. You know, however small an improvement, I'll take it.
This whole experience has really opened up my eyes to how MS can affect a person's whole life and not just their physical abilities, which I'm hoping will allow me to be a better clinician in the future. I know that now to look at the big picture and not just focus on one small impairment, and I think that that can be very beneficial for patients with MS.
According to a recent survey conducted by the MS Society, one of the greatest unmet needs for patients with MS in the southeastern United States was physical therapy. In fact, many rural counties in North Carolina are in need of physical therapists.
It's not easy to find someone who understands the unique challenges that a person with MS faces, especially in the light of fatigue.
Physical therapists are dedicated to helping each person address the challenges of daily life.
Because of the scholarship and education track, I've been able to spend a lot of my time outside of class gaining clinical experience. So I've been able to visit with local physical therapists and neurologists here at UNC and within the Triangle to increase my exposure to patients with MS.
The MS scholarship will, I truly believe, encourage more MS patients to take advantage of physical therapy. There are physical therapists out there who are not terribly familiar with MS, and the scholarship will enable more people to be able to connect with MS patients. And believe me, the MS community is very tight-knit. Word will get out.
Being a physical therapy student, I see that there's really a great need to educate students in MS and in treating patients with neurodiagnoses, and I think that this scholarship is really providing that opportunity, and hopefully it will continue to grow from UNC to other schools, so it will really help to fulfill the need that exists in North Carolina and also just across the nation.
We welcome contributions from alumni, colleagues, and friends to endow a permanent UNC Chapel Hill Physical Therapy MS Scholarship to continue to attract exceptional students like Erica from North Carolina and around the world to study here in Chapel Hill. Diane and Erica's goal is to keep Barbara and other individuals with MS moving. The Physical Therapy MS Scholarship Committee now seeks to endow the scholarship at the Medical Foundation of North Carolina Incorporated so that future generations of physical therapy students like Erica attending UNC Chapel Hill have the necessary clinical mentorship, classroom training, and relevant experiences to keep people with MS moving.